Hello, my name is Dr. Stephanie Stroud. I am one of the associate veterinarians as well as the director of the rehabilitation program here at Cornerstone Animal Hospital. I've been here since January off and on, but I've now switched to being full-time with Cornerstone Animal Hospital, and I'm very excited to be part of the team here that's providing the highest quality care for your fur babies. So, a little background about myself. I did my undergraduate degree in Springfield at Missouri State University, and then I went and received my doctorate of veterinary medicine at the University of Missouri in Columbia. If you'd like to hear more about the background story of how I became a veterinarian, you can go to the Cornerstone Animal Hospital webpage, go to the About section and click on Dr. Stroud, and you can hear exactly why I decided to become a veterinarian. But today I kind of want to share with you the 2 reasons why I chose to be a veterinarian at Cornerstone Animal Hospital in particular. There are lots of veterinary hospitals in the southwest Missouri area, but there's 2 reasons that I chose specifically to be at Cornerstone Animal Hospital. The first is that they're AAHA accredited. The second is that they are constantly on the cutting edge of medicine. So let's talk about that first one first. AAHA accreditation. What does that mean? Why do I care? Why should you care? AAHA basically stands for the American Animal Hospital Association, and what that association does is it ensures that a veterinary practice that is accredited practices at the highest standards and highest quality of veterinary medicine that is out in our field right now. They're constantly updating, they're constantly looking for new ways to serve our pets and to take care of your pets and your family as a whole. And so they do that through a couple different mechanisms of standards that hospitals that are AAHA accredited are required to meet. And I'm going to talk about some of those standards because you may not know about them. Okay, so one of the standards that AAHA accredited hospitals are required to have is that they have to be very thorough. Okay, so when we're talking about thoroughness, is we are talking from the nose of your animal to the tail of your animal. That means that as doctors we are examining the eyes, the nose, the teeth, the tonsils, the ears, the lymph nodes, the heart, the lungs, the belly, feeling for in the abdomen to make sure we don't have any problems in the abdomen. We are feeling joints. We're feeling, are those joints in the proper range of motion like they should be? Do we have any neurologic deficits? So we are going from the nose all the way to the tail because we want to make sure we are very thorough and that we are taking care of your fur babies because they are an important part of your family. So that is one of the first things that AAHA accredited hospitals are required to be. Is they're required to be very thorough, and we have those checks and balances to make sure we as doctors are performing thorough exams. Okay. The next requirement that AAHA has is that we are responsive ready, and what that means is that we are actually required to have a crash cart or a safety cart that has equipment for CPR, that has equipment for emergency medications, emergency drugs. So if you walk in with an emergency, we can be as ready as we can to save your animal to the best of our abilities. And so AAHA requires us to be ready to go, and that's what the responsive is, so that we can tackle any emergency, any condition that is there, so we can do the best to keep your pets and your family members well and alive. Okay, the next thing that AAHA requires is that we be sanitary. Okay, that means that that's promoting safety for us as humans and safety for our pets. There's nothing worse than bringing your healthy pet, or even you as a human, going to your doctor or to the hospital to get your annual wellness exam, to make sure you're healthy, and then you get sick because you're going to the hospital where there's sick patients. And so AAHA requires that we have biosecurity systems in place to protect the well pets from the sick pets. And so we're stopping and decontaminating and decreasing the risk of infection. That is a requirement for with AAHA. Okay. The last one that AAHA, the conditions that AAHA kind of falls under, and there's many little subcategories to all these things, but the last condition talks about humane handling. when our pets come in here, there's all kinds of different smells, noises, new pets that they maybe haven't met before, and sometimes that can be very, very stressful to them. It can be hard on them, and so us being able to use very safe protocols and humanely handling them and identifying and reading body language of stressors is part of the requirements of becoming AAHA accredited, which again, Cornerstone is AAHA accredited. So that is one of the reasons I have chosen to be a veterinarian here at Cornerstone Animal Hospital, is the fact that they're AAHA certified. It means we are practicing the highest quality of medicine here at Cornerstone Animal Hospital. Okay, so the second reason that I chose to come to be a veterinarian at Cornerstone Animal Hospital is the fact that they are constantly on the cutting edge of medicine, guys. It is very, very exciting to me to be able to be a veterinarian in this time, in this specific field of medicine. Here at Cornerstone, we are offering stem cell therapy. We're offering platelet-rich plasma for treatment of arthritis and injuries and wounds. As I told you at the beginning of this video, I have come down to Cornerstone to be the director of the rehabilitation program that we'll be launching in this summer, where we'll have an underwater treadmill, and we're going to have all kinds of tools in order to help our pets have the best quality of life while minimizing the number of medications that they have to be on. So I'm just terribly, terribly excited about this. Oh, I see some people join me. Thanks so much for joining on, guys. I'm so excited that you guys are here and to be joining you guys. So, the fact that we're AAHA accredited, the fact that Cornerstone Animal Hospital is on the cutting edge and continues to be on the cutting edge. I, as well as the rest of the doctors here, the veterinarians here, we are aimed and are diligent about getting continuing education, okay? The state of Missouri actually only requires us as veterinarians to get 10 hours of continuing education. In a field that is vastly changing with new medicine and new techniques coming up, 10 hours, in my opinion, is just not enough. And so here at Cornerstone, we are dedicated to getting at least 30 hours of continuing education. Many of us here at Cornerstone get more than 30 hours because, again, we are dedicated to be the cutting edge so we can offer the best, the highest quality, and keep your pets alive and well and taken care of for as long as they are supposed to live. So if you have questions, if you have comments, feel free to drop them below. Like I said, I'm excited to be here. I suspect that we will be doing more live sessions here over the next coming month. So keep an eye and look out for that. Otherwise, I will see you guys later. All right, have a great night. Bye-bye.